All right, we are calling to order the Housing and Community Development meeting on Wednesday, July the 8th. The time is now 6:34 p.m. I'll start with the roll call of the committee, starting with Alderwoman Ellie Tierney.
Present. I'm present.
Thank you. Nancy Lipson.
Present.
Teresa Bond.
Present.
And Tony Pratt.
Present.
Awesome. Next up on the agenda is approval of the minutes from our last meeting on June the 10th. Is there a motion to approve the minutes from our meeting on June the 10th, 2020?
I'll motion that to approve the minutes.
I'll second that.
All in favor?
Aye.
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 Motion carries. The minutes are approved. And at this time, I will now turn things over to Teresa Wellman so that she's able to explain the CDBGC application presentations and how we'll work this process.
Okay. We can bring all the applicants on now. So back in, so they can hear it too. So back in April, the purpose of this meeting, review the CDBG CV applications that we received. Back in April, HUD gave us about $156,000 to specifically for public service projects. And the money had to be used for either the prevention of, the preparation for, or the response to the coronavirus. It also had to meet the low and moderate income national objective, and it needed to meet eligible activities, just very similar to the regular CDBG, only they lifted the cap on public services and let us use all the money for public services, but it still needs to meet all the requirements. And the projects could be used for housing assistance, mental health assistance, food assistance, prevention assistance, protection, transportation, utilities, basic needs, all different kinds of things that are responses or preparation or prevention of COVID. They also allowed us they were also allowing us to pay for things that people, some people might have, or organizations might have already spent money on, like especially like protection and prevention. The way they're doing this, the way HUD is doing this is they're giving us this money as an amendment to our 2020, which we just closed out. So it's an amendment to our 2020 plan. It's not like a whole new thing. So what we decided to do was to take a look at the organizations that already had 2020 money. So they were already vetted. And then we took a look at the organizations out of those public service organizations. We looked at the organizations that were either had the ability to do these activities or were already involved. And in our case, the 6 organizations that we had were already involved in doing these types of activities. So I asked people to send in their ideas, and we took a look at those, and HUD took a look at those, and then we invited you to put in applications. So what we're going to do is ask you to talk about your application, just like we do at a regular CDBG public hearing, where everybody goes through and explains their application. Take 5 minutes and follow the presentation guidelines that I sent. We're going to go in alphabetical order. I wanted everybody to be involved so you could hear each other's projects. There might be opportunities for networking. So does anybody have any questions before we get started?
I just want to make sure before we move forward that Ryan and knows the procedure that we'll follow. We'll take a vote at the end of this meeting. I'm sorry, at the end of their presentations, to go into a closed session or executive session for as long as it takes to deliberate. And then we'll come back to this same meeting. So there'll be in between, and also for the general public, in between there'll be a blank screen or the city's mural or during the deliberation period, just making that clear.
Yep, Dewan, I do just want to clarify. Unfortunately, with how Zoom works, it's going to be 2 different YouTube videos. So the stream will actually close and then reopen in that window.
Okay, and so we're all directed to the same link, correct?
No, unfortunately, with how it's set up, I don't know if that's an option right now, but I can provide that at the end.
Okay, awesome. Thank you.
Okay. Any questions from the applicants? All right, so Arundel Lodge, you're first. Mike Drummond. You got to unmute.
There you go. Thank you very much for this opportunity to present what we're doing as a result of COVID-19, and appreciate your involvement in making Annapolis a better place to live for everyone. So Arundel Lodge is many of you know us, is a community behavioral health center that provides a comprehensive range of services. Obviously, we had to adjust the way we delivered our services. Our day program early in March needed to be closed. It also had a adult congregate care, a congregate meal program, and we converted that to have our day program staff take those meals to our residential houses, as well as community members who were using the day program and who may have depended upon those meals as part of their weekly food budget. The day program staff also at the residences outside would try to provide programs and activities that would help mitigate the boredom and sense of being locked up in the houses by providing additional programming. The residential program was obviously something in which I really need to praise the residential staff who continued to report to work. We needed to put in place a lot of safety procedures, so we had all of our staff check for their symptoms and check their temperature before reporting to work every day. We operate 32 homes with up to 110 residents. And at least so far, we have not had a resident who has had the illness transmitted to them. We really have worked very hard because they have a lot of comorbid medical conditions, which could put them at risk if they contracted the virus. So we've been following essentially policies and procedures that were first developed for assisted living and nursing home facilities, although our homes are much different because, and our clients don't have the same level of supervision. So part of the proposal and part of our expenses has been purchasing personal protective equipment for our staff and for our residents, and cleaning supplies in order to clean all those surfaces. That was part of the budget. Our outpatient clinic serves persons with mental health and substance use disorders. We have a program for 0 to 5. We have a children and family program for 5 to 17 years old in our outpatient treatment services, an outpatient mental health clinic, and outpatient substance use disorder services at 2 locations, 1819 Bay Ridge Avenue, 2600 Solomons Island Road, and we have a satellite program that we had just started at the Stanton Center for youth and families there in terms of counseling. that program needed to be sort of transitioned quickly to a telemedicine approach. And so the other large expenditures in our grant proposal was setting up a virtual behavioral health suite for us to be able to see clients, and where they would come, enter the waiting room, and their clinicians and therapists would meet them in the waiting room and then conduct a HIPAA compliant, secure therapy session or medication management session. We do in our clinic see a few people face to face who can't be, whom we can't work with either telephonically or using the video connection. So far, since we made that conversion, we have currently treated since March 23rd until today. I ran a report, 2,733 clients receiving services through telemedicine. And again, it was a huge lift for us to kind of redefine our staff's responsibilities in terms of making that happen and helping and assisting our clients to learn how to connect with us through video conferencing. Since we submitted the application, I think at the time of our application, we had identified almost $36,000 worth of expenses that were added to accomplish those things. We did get a $10,000 grant from a foundation. So we had asked for almost $26,000. And since that time, our total expenditures have now grown from $35,900 to over $53,000. So obviously there continue to be ongoing expenses in order to support our clients who need behavioral health services, but they need to be delivered in different ways, and we need to maintain our things. We've spent a lot of this money already in the ways that I've described. As I said, there's been 2,700 people just in the outpatient program who've benefited from this service, and 106 people who've benefited from being able to use our residential services and to maintain that safely. So I think there really isn't another organization which provides the span of services we do. And, part of our mission has been to try to increase access and make the capacity of behavioral health services meet what the needs are in the community. And that certainly has been something that's been growing during the pandemic. So I think that's the best summary I can give. And if there are any questions, please feel free to ask them.
So I'll kick it off, and then I'll open it up to the committee for questions. And I thank you, Mike, for breaking down the summary of what Arundel Lodge has done and what it's provided. For the residential program, you mentioned it had 32 homes and 110 residents. Is that on a campus, or is that 32 homes that you visit throughout the county?
So there are 32 homes, 26, maybe more than that now. Somewhere around 27 are inside the city of Annapolis, and they're normal townhouses or single family homes. We staff each of those homes differently depending upon the acuity of the clients and what their needs are. So some homes are 24/7, in which we have a staff person there 24 hours around the clock. There are other homes that are for people who are more independent and getting ready to live in their own housing. So we visit those homes a couple of times a day. We have homes that are for persons with mental health and co-occurring developmental disorders, mental health and co-occurring substance use disorders, and mental health and co-occurring for persons who are hard of hearing or deaf. We have behavioral health homes for those individuals with a co-occurring behavioral health disorder. So there's a lot of different needs, and the programs are staffed to each home's requirements, really, in terms of how to support the residents best.
And for the, I just had two more quickly. For the Stanton Center program, are there plans to eventually, as we go into this second phase, or as we're in the second phase, looking towards the third, to bring that to the Stanton Center on a maybe trial basis, just to see how it could work potentially, in particular with the youth I'm worried about?
Right. So a couple of things right now in terms of the pandemic and COVID-19. While there's more opening up of the community, one of the rules we've tried to follow is if something doesn't have to be done face to face in order to prevent the transmission of the disorder, we should not do it that way. So if you think about a counseling room, a lot of our spaces are very difficult to get that 6 feet of social distancing. In addition, people, while they're together for 45 minutes or an hour, both the therapist and the clients would have to be wearing a mask. So that also impedes the value of the communication and support that can be given. And I think it's actually worse than doing it by telephonically or with video. So there are some clients whom we see face to face because that's the best way to provide services. But until there's better testing, better contact tracing, I don't think that's the right way to move until we have a better handle on the safety issue. So we'll continue to do that telephonically and with video conferencing. And after that's over, sometime in the future, then yes, we want the staff at that Stanton Center to increase. And it's really going to need to be driven by the numbers of people who are seeking the services, because to be honest, outpatient mental health is one of the toughest thing about it is that the rates of reimbursement don't pay for all the costs. And like this year, I think we've already lost $100,000 on our outpatient treatment. We see all payers. We see people who are uninsured. We see people who are undocumented. And all of that complexity in billing means that it's very hard to put together. But our commitment is that we need to serve the populations and the places and the people who need the help the most. And that's what our goal is in trying to provide those services at the Stanton Center. And so I look to return there. I would love for it to flourish at Clay and Washington Street.
And just one more quick question. How has it been, doing therapy or any of the outpatient services using technology? Do you find that the people who need it most have the technological resources available so that they can get the assistance they need from you?
Right. So what we're doing right now is, I would say of all of our appointments and serving the 2,700 people, I didn't run a report on numbers of services, but it will surprise you the size of it. Of all of those appointments, about 2/3 are people have the technology, and about 1/3 we have to drop to telephone because they don't have the technology. I've been really focused on that metric and trying to increase the percentage of our clients that we can do video conferencing with, because the research is that is as effective, and a lot of our clients prefer it. So, anecdotally, you can talk about, we have a senior citizen and she saw me and she said, I'm loving this because I have to pay $15 in cab fare each way to get to my appointment. And now I can meet with my nurse practitioner, I can meet with my therapist, and I can save that $30. And for someone on fixed income, that makes a big difference. So in some ways, it's been more, it's increased the accessibility of the service. And we definitely are hoping that post-pandemic, we can continue this as an option for clients who would prefer to do it that way.
Awesome. Thank you very much. Anyone else? Ms. Pratt?
Yes, hello, Mr. Drummond. I have two questions. how many new, if any, substance use clients have you added or treated since the pandemic?
I can run that number for you, Tony. I don't have that right off the, I didn't try to pull that up for you, but I can run that number and get it to you.
And have you seen an increase in clients since the pandemic for substance use disorder, since our overdoses have increased?
The overdoses have increased, and I think the overdose deaths have increased as well. And I think for at least some of the people who have a substance use disorder, the face-to-face support groups are a critical part of their recovery. And so one of the things we'll probably do in the clinic, although we haven't initiated it yet, one of the first face-to-face things we will bring back is to take one of our largest group rooms and sort of divide it up so you can maintain the 6 feet. We'll have to have people in masks, but just the ability to come and in smaller groups at least meet others and talk about what they're doing and how they're managing. We have seen an increase in demand. Most of our clients usually have both a mental health disorder and a substance use disorder, and our intakes have increased during the last few weeks. And the final thing I would say about that is I know we've talked and they've increased despite the fact that I wish it was easier to open up start to see a new client, because what we have to do is there's a lot of rules and regulations and consents that we have to get. So right now, we used to have same day access when our offices were open. Right now, what happens if somebody calls, we explain the clinic to them. We go over, their confidentiality and different aspects of treatment. We then push out documents which cover all of that to them, and their consent for treatment is done by DocuSign, so they can sign the consent. And usually that takes part of a day. So their first diagnostic evaluation is the next day now. And it's a little clunkier because it requires them having an email address. It requires us using DocuSign. It requires the telephone. And it takes longer and you're going back and forth a little bit. But I am trying to work with some IT companies to really streamline that so that it can happen off of a link on our website, and people can be looking at the documents and sign there as they're talking to the intake person, and have everything in one place so that we can start the appointment more quickly. So I've found a company that has a product that I think will help us with that. The next piece is I've got to get the company that provides our electronic health record cooperating with and doing the work they need to do to build a bridge, so that after somebody's done that in this one secure site, all that information can get then transferred into their electronic health record. And once we're there, then it will be as close as we can get to somebody walking in and asking for services.
Thank you. And my last question is, have you seen a drop in clients keeping their appointments since you moved to telephonic therapy?
No, it's because it's easier for people to get to, and it doesn't take as much of their day in order to travel to one of our locations, and then go back home again. There's less that they have to organize in order to keep that appointment. So it's actually our no-shows have dropped, or our cancellations have dropped since we've shifted to telemedicine.
Thank you.
Juan, I have a quick question.
Yeah, absolutely. Alderwoman Tierney.
Yeah, hi. You're seeing Smokey the fire dog in me instead of me because I'm walking to City Hall. My quick question, and it's kind of for Teresa too. The money requested, is this an estimate of cost to date? My concern is what's the time frame that you anticipate that you're going to, be needing this kind of support, or is this basically cost to date?
So this is actually cost to the time I submitted the application, and the cost to date is now about 53,000, which we did get the $10,000 grant to help us with that. And so that's where things are now.
Okay, I asked that because it, you know, it appears with the national issue of this that, you know, we're going to be in this for the long haul. So I just wanted to put that in perspective.
Mhm.
Okay, thanks, Mike.
Thank you.
Any further questions from the committee? No hands. All right. Next up, Teresa. It's alphabetical. Is this list correct that we have? Oh, no, it's not, because Michael went first. I think next up is Blessed in Tech, correct?
It's soon to, oh, there we go. Yes, it's Blessed in Tech.
Awesome.
Good evening, everyone. Thank you all again for allowing us opportunity to be a part of this opportunity. Again, Blessing Tech Ministries is a place of empowerment. We do case management. We assist with training. We assist with anyone that's homeless, anyone that's disadvantaged as far as homeless youth and or individuals and families. We connect people up with different resources as they need it. And during the COVID-19, we officially closed our doors March the 16th. And we went remote. We went online. So we did everything virtually. We were in the middle of a basic computer literacy class at the time. Our offices are down at DSS, 80 West Street, Indianapolis, Maryland, in Suite A. And we had to convert our online classes, our classroom classes over to online. We lost 2 students during that transition. However, we did have 2 students to graduate at the end of it. We did basic computer literacy, and we also continued with our case management. Anyone that walked in the door, if they needed any assistance with anything, we assisted them with anything regarding Department of Social Services benefits. We assisted them with connecting them up with OLA, which is the Hispanics organization. We assisted them with unemployment, employment, anything that they came in for. We also did a lot of resource referrals for them as well. During COVID-19, we pretty much do the same thing. We have classes that are about to start with Oberry Court. They asked us to start some classes doing resume building and basic computer literacy, in addition to some other things, interviewing skills and such. We're about to start our partnership, continue our partnership with OIC, doing basic computer literacy, but we're going to the next class, which is Office Essentials, Microsoft Office Essentials. Amen. And then also we have, let's see here, I just want to make sure I got everything. Now, what we've been doing with our intakes, when someone contacts us, we will set them up with an intake, and we do that virtually through using Dawsey, which allows them to go in somewhat of a wait room. And then we click them on, and they're able to see us, and we're able to see them, so that we can verify who they are that we're talking to do the intake. We're able to transfer documents back and forth, and they're able to actually sign a document at the end of our session electronically. And then we can start them on the process of getting everything that they need. One of the huge things that we've been doing is we've been assisting Feed Arundel and Pastor Cheryl with the food distribution and sorting, and the city of Annapolis as well, with getting some food delivered. And we've also, with our program, Men on a Mission, we've been assisting seniors with food shopping, anything they need, their medicine, if they need medicine picked up and they can't afford their medicine. We've been paying for their medicine. We've been shopping for them. We've been going to their homes, of course, protected, removing trash that they can't take themselves because their aides are not there. So we've been doing quite a few different things out of the norm, but it's necessary during this COVID-19 pandemic. We've been getting a lot of inquiries with regards to unemployment. issues that people are having with unemployment. We've been very successful in getting people their unemployment. It could be because they didn't submit their paperwork at the time of application. And we actually go through the process of actually helping them to submit their application as well as, and also for the food stamps and things of that sort as well. So we've been a little busy. We're normally open on Tuesdays and Thursdays, but we've been open Monday through Friday and sometimes Saturday, because sometimes on Saturdays we have to visit our seniors to assist them with some things. I wanted to stay on task with the questions. We do a lot of referrals to DSS, People Encouraging People, Arundel Lodge, and other agencies. Mike is doing a phenomenal job. I've been sending people to him like crazy. We are, let's see, we would like, well, the application itself indicates how we would like to spend the CBDG funds. And again, we said that we would like to do about 300 clients. To date, we've assisted since COVID-19 began here in Maryland, 151 clients to date. Of course, we're going to be assisting those that are low to moderate income, seniors, individuals, families, homeless individuals, youths, as well as those fleeing domestic violence. Now, we have run into about three homeless youth during this pandemic, two recently, maybe about 3 weeks ago. And we assisted them with getting shelter. One was 16 and one was 18. The 18-year-old was able to get shelter, but we were able to get the 16-year-old back into the home with their parents. So we were happy about that. Our readiness to proceed, we've been working, so we just keep going with or without any funding. And we definitely need to get additional protective equipment, of course, to continue to work. We have been fortunate enough to get several grants from it's the Crisis Response Grant through the Community Foundation of Anne Arundel County. So we've been fortunate enough to get 3 cycles of that. And let's see here. And the organizations that are doing similar, like I said, Pastor Cheryl with the Community Development Corporation, Restoration Community Development Corporation, has been doing an amazing job. Also, Feed Arundel, City of Annapolis Office of Emergency Management. There's a lot of organizations already out there feeding people and making sure that they're taken care of with food deliveries and such. And we're just adding that to. We're not taking away from what they're doing. We're just being a help where we can. And I think that, I'm not sure, but I think that we're the only ones who's actually providing the personal shopping and, you know, medicine and things of that sort to the clients during this pandemic. And also we had mentioned in our application that we wanted to assist with hotel stays for those that do test positive in households. Now the Lighthouse, I know, is doing that already. And I know that the Department of Social Services is also doing that as well. We just want to be a help, an additional resource for those organizations. We're also trying to develop online Narcotic Anonymous meetings as NA meetings, NAA meetings, to help with the problem that we've been experiencing as far as the ODs. We've personally lost 2 of our clients during this pandemic to 2 of our homeless, well, one was homeless and the other one just got housed, to overdose. And so that's a huge thing for us that we're trying to get going. So we're looking into some organizations to partner with so we can get that going as soon as possible. We find that the DOSI is actually allowing us to bridge the gap with those that are experiencing depression during this time. A lot of our clients, because they're not seeing us face to face and they're used to coming in if they're homeless and things of that sort, they get comfort when they hear our voice over the phone, or even if they're able to actually see us. So we use the DOSI a lot So we keep the lines open during our hours of operation so that anybody can come in. It's like a little wait room, and we're able to, click on them, and we're here for them. So that's one of the things. I'm trying to think, was there anything else? Oh, and we do run the winter relief over at the Stanton Center now. So I think that is it. If anyone has any questions for me, I'm definitely ready to answer.
Any questions from the committee? Nancy? Yeah, volume.
My one question, and I suppose I could ask any of the applicants this, what happens if you don't get enough, if you don't get all the funding you've requested, and you get just a portion of it? Have you figured out what you would do in that event? Are there things you would cut out, or just how would you handle that?
We'll just keep going as much as we can without breaking our bank. We provide the services as much as we can to whomever comes in, especially those that are really vulnerable, the seniors that are really vulnerable, and those that have autoimmune vulnerabilities. They know they can't go out, because it could risk their life. So we go out for them. So we do as much as we can while we can, for as long as we can.
Any more questions? Awesome. Thanks. Thank you very, very much. I appreciate it.
Thank you.
Next up is Center of Help. Is there a representative from the Center of Help? Oh, awesome. Kirsten Clark. Did I pronounce that correctly?
You did. I'm impressed.
Great. Thank you very much for being here. And whenever you're ready, please feel free to start.
Good evening, everyone. As Alderman Gay introduced me, I am Kirsten Clark. I am Executive Director of Center of Help here in Annapolis. We are a comprehensive resource center for the immigrant community in the city. Since the COVID crisis hit, we have been extremely busy, as most of the other applicants here. Our casework services are all happening remotely. We're actually utilizing the Google Voice feature on our Google Suite, so our caseworkers are able to attend to clients over the phone as well as send text messages. And there are a lot of clients calling. We have an influx of a lot of new clients. The cases in June of this year were actually a total of 1,150, as opposed to in 2019, we had 502. So we have more than doubled the amount of cases that we are attending, and that's just the casework program. That's not including our education services or the expanded food access that we have been working on. We are partnering with the West Annapolis Pop-Up Pantry, which they just popped up, as their name said, as the COVID crisis hit, and they are a group of volunteers who have been assisting us with food access. We have a Saturday food distribution site that is rotating between 3 locations, which is the Allen Apartments complex, the Admiral Farragut Apartments, and the Admiral Oaks Apartments, which were all chosen based off of need in the community and where some gaps between other food access sites were seen, as well as that they're pretty heavily immigrant communities in those complexes. We are asking for funds specifically for our food delivery services. We are delivering to about 140 families a week, 70 every Tuesday and 70 every Thursday. And these are families who are affected by COVID, and so they cannot go out to the other distribution sites. It could be seniors. It's also some immunocompromised individuals, people with existing illnesses or disorders. Also families who are directly affected by positive COVID cases or those who have had contact, so they are in quarantine and so they can't leave their homes. We are also asking for some money for printing in order to ensure that we're getting flyers out to these families with access to our other services so they're able to contact our caseworkers for issues that are not related to food, which can include unemployment applications. If they're eligible for the SNAP program, we can help them with those applications, any medical bills that they may be dealing with, applying for financial assistance. And we are also, one of our caseworkers is on site every Saturday. And so we are requesting funding for those extra hours that she's putting in on site. And that has been extremely beneficial for some of our clients who have really limited knowledge of technology, may not even be able to work a cell phone well, that they're able to have that contact with her on site, make that first conversation, and then follow up afterwards. In terms of our readiness to proceed, everything is going, and we won't stop. Our group of volunteers is ruthless, truly. I've been amazed to see the amount of hours, the amount of energy that people are putting into helping families during this time. And in terms of sustainability, this funding is essentially filling some of the funding gaps that we have right now and will ensure sustainability. We hope to continue at the same pace that we are right now through the end of December, and then slowly taper off. In other funding that we have been able to get for our COVID-related projects, the Arundel Community Development Services is helping us with our Saturday efforts, which is why we're asking the CDBG funding specifically for deliveries. Additionally, Downtown Hope and the Evangelical Presbyterian Church have been assisting Center of Hope with a lot of our efforts. And we also received crisis response money from the Community Foundation. Some of those are going to Saturday, some are going to delivery, and then some are going to our emergency grant fund, where we're also able to help clients who don't qualify for funding for the eviction prevention program or for SNAP services because of lack of documentation. And those applications can be really comprehensive, so they have to get a lot of paperwork together. And for some of our clients, due to their situations, they are not able to get all of that paperwork together. And so we're able to have sort of a backup catch fund in order to assist some of those families after further investigation if our caseworkers aren't able to get them assistance through one of the county or city programs. In other agencies that are doing what we're doing, we are collaborating a lot. We work with Our Lady of Guadalupe Ministry, who is actually not doing food deliveries because they're focusing on the medical supplies and rent and funeral expenses. The Partnership for Children, Youth, and Families, we are working with a lot. All of the Annapolis food-related groups are meeting twice a month in order to discuss how things are going and strategies, as well as make sure that we're not overlapping. And we are working with the Annapolis Police Department and Health Department as well with those families that are COVID positive or the contact tracers have identified as people who have been in contact, in order to make sure that they are keeping quarantine and that they're getting all of the food and essential items that they need. And that's all. Do you have any questions?
Wow.
Yeah, wow.
I do have actually some questions. So in the city of Annapolis, it's reported that there are 75% of the Hispanic and Latino community make up the COVID or make up a percentage of those infected with COVID. So how do you, what are the steps being taken? I don't think you talked about that, to ensure that the staff is not, potentially harmed or open to infection.
Yeah, and so this is one of the reasons that having the delivery services is important to us, because we are receiving information about those positive families from people like the health department. And so we're able to drop them off at their front door and not have them come to our events on Saturdays. That being said, we do maintain social distancing, and we have received PPE from the Partnership for Children, Youth, and Families. So all of our staff actually has access to N95 masks, and we have gloves and all of the antibacterial that we need.
And are you working with, there's a group that meet on Saturdays at Tyler Heights Elementary School. Are you working with them as well?
So we don't necessarily partner with them directly, but all of the groups that are doing food access in Annapolis, we're meeting bi-weekly to discuss and to coordinate. So finding sources for the food donations and things like that, we're able to be in constant communication. So some of the sources that we're getting are sending food to Pastor Menendez's group and to Tyler Heights and to us, and some of them are smaller organizations that are helping to come to one and not the other. So it's constantly in flux, but we're definitely communicating with everyone regularly.
Awesome. Thank you. Any more questions from the committee?
I just had a quick question on how much, it's Ellie Tierney. How much of this or how much are you needing as far as PPP equipment, handling food, gloves, all that kind of stuff? How are you doing with that?
I think we're okay for now, but probably in a few months we'll need to get more. I think that probably the next Community Foundation crisis grant will apply for some more funding to get PPE to sustain us through.
And you're getting the information you need from the county health department?
Yes, we have been very lucky to be in regular communication with them. About half of our board sits on the equity committee for the health department now, so we definitely have a lot of resources.
Okay.
The county has been really great.
Great, good. Thank you.
Any more questions from the committee? Yep, awesome. Thank you, Ms. Clark. Very much.
I think, yeah.
Oh, sorry. Wait, Tony.
Right. Do the Center of Help just service the Hispanic population?
So our mission is to serve the immigrant community. So we do serve other immigrants other than Hispanics, but because of the population makeup, the majority of our clients are Hispanic.
Thank you.
Any more questions from the committee before? Awesome. Thank you, Ms. Clark. Next up is the Housing Authority, Ms. Maddox Evans. How are you?
Good, how are you?
I'm doing well.
Thank you so much for allowing us to come before you today as a commission to just talk about some of our needs at the Housing Authority. As you're all aware, we provide housing opportunities for over 1,100 families in the area and over 700 families being in our public housing community. And of course, COVID-19 has hit us rather hard as far as having to adjust our operations. But that's no different from, as we've heard to date, what other organizations have experienced. I wanted to also introduce to you Jennifer Adams, who is our new Director of Development. She just came on just a couple months ago, right during a pandemic. And so she has hit the ground running and has been instrumental in organizing many of the funding sources and issues that we need. So I'm gonna have her go through the presentation, and Jennifer, you can pull it up. Just to give you an overview, we have several funding sources, and although we have some significant funding sources, we also have some very significant expenses, which is why we're pursuing grant funds from every source possible. So we have CARES Act funds, of course, because we are a government institution, housing authority. We have pursued FEMA funds. We have had to utilize our capital fund and operating expenses. And of course, we're now pursuing CDBG funds. But just to give you an example, out of the $506,000 that was allocated in CARE funds, we've already expended $300,000 for our different expenses. And so expenses include retrofitting, for example, our facilities to be COVID prepared. So hands-free bathroom facilities, social distancing markers, all that. And we also, just to give you an example of an expense, I just got a quote today to be able to upgrade all of our community centers. That would be about $61,000. So just as an example, you can see how quickly those amounts go. And of course, we've already expended our FEMA allocation. We see these issues that COVID has brought to us to be long-term and lasting for quite some time. And so we don't see the need dwindling anytime soon. And we have a variety of needs, from making sure that we have enough resources to feed our families, all of the residents. We have great partnerships, and one, of course, with Pastor Menendez, and Tony Pratt has assisted us, and so many other organizations. But our staffing has had to readjust to be able to accommodate just that function, for example, in addition to the other functions that we perform. And so I'm going to let Jennifer talk a bit about what some of the other needs are as she has put together in this presentation. But I just wanted to give you sort of an overview of some of the significant expenses that we have at our agency. Jennifer?
Sure, yep. So I was flipping through here, just a couple of slides that we put together. This was the amended budget that we provided with all of our costs, CARES, funded by CARES, FEMA, as well as the overage that we'll need to pay from HACA's operating fund. I think Melissa did a great job of the overview of services. We're providing resident services through food distribution and partnering with Arundel County Public Schools to make sure that the kids back in the school year were having access to their assignments, and also keeping up with them during the summer. We found the need to look at a lot of different technology upgrades in order to deliver our services, especially rent, all sorts of services, rent intake, application intake, and all sorts of things. Looking at a kiosk system that we can put at each of our community centers in order to make it so that people can do a lot of things online without having to interface with people. We also, of course, had the basic needs of PPE, as everyone else has discussed, in order to go in and do things like emergency work orders and clean facilities. We have 5 properties that we are managing right now where we need to make sure that common areas are appropriately cleaned, as well as our office and our employees. And so here's just a quick breakdown that I was showing of all the different categories that we are funding. Specifically to the CDBG, we've requested $15,000. That's $1,000 towards our PPE, $2,500 or $6,500 towards facility cleaning, which we are hoping to open our community centers here in the next month or two, and expect that we will have some pretty heavy needs in the cleaning side in order to make sure that those, again, are appropriately maintained. We're also doing some of those services ourselves, so that's $1,000 on the HACA side for supplies to purchase, and also for staffing for distribution of meals. We are partnering with many agencies in order to get the food out at several sites, and so are incurring plenty of staff time to do that. Who will benefit and how many people? Of course, we have 60 staff of 60 and manage 712 public housing households. So those are the direct beneficiaries. And our readiness to proceed, we're proceeding just like everyone else. We've been proceeding since March, and this is we've spent approximately $50% of our budget at this time. And as Melissa reiterated, we expect to continue on through for several months in order to provide a response. So again, here's some of our funding sources. CDBG makes up a small portion of that. HACA will also be putting in money as well in order to fund this budget. And so the last piece about partnering with other agencies, partnering with the City Office of Emergency Management to actually bring COVID testing to some specific sites, have done Blum and Robinwood. We have partnered with Anne Arundel County Public Schools, as I mentioned earlier, to provide academic support, as well as the County Office for Disability and Aging for Senior Services and info sessions at HACA pop-ups, the Maryland Food Bank, and Light of the World Ministries for food distribution. Also on, do have a summer camp outside that we have been underway for a couple of weeks, and we have free art classes that we can offer to those kids enrolled. We've also partnered with Comcast to provide free internet during this time, and they've also provided some technology to our resident council members. Working with Action Annapolis on voter registration, and also working on rental insurance assistance for residents. So that's the short story.
So we'd be happy to answer any questions you may have.
Awesome. Thank you guys for the presentation. I just have quick questions, and then obviously opening up to the rest of the committee as well. My first question is what changes to the infrastructure that the residents occupy? Well, no, let me first start with, I think that one of the issues that we have within our predominantly Black communities, and why the statistics are shown the way it is, with the Hispanic and Latino communities making up 75% of COVID cases, is because they actually get tested. The issues that we have in our communities is, I don't know, there's a fear of testing, or there isn't testing, but we know that there are many of our neighbors who are infected with COVID-19 who are asymptomatic and young. And so the COVID-19 is being transferred easily amongst on our properties. And so how, within the residential structures, what plans are in place? For example, like in my buildings, I know that they put place like hand dispensers out at the front of our, and stuff like that, little pedal stops so that we're not touching the door. Is that infrastructure being installed in not only the administrative offices, but in the buildings, so that residents are, at least keeping up with hygiene requirements?
And that's certainly something that we can consider. So we've sort of started with a sort of phases. And so in order for us to be able to operate, we had to make sure our offices were structured properly so we could actually get back to work full time and not be susceptible unnecessarily to the virus. Then we're moving to community centers and figuring out how to retrofit those centers. So after that, we can review the residential buildings to see what types of needs each of the buildings need, which they're going to vary depending on the spaces. We've done comprehensive cleaning to the common areas. For example, within Harbor House in Eastport, we had a cleaning service do extensive cleaning in the hallways, for example, of that. And we've done that also for the Blum building, the residential building, maybe at least 2 times. And we plan to do that on rotation. And we plan to have the extensive cleaning on rotation also for common areas that the residents attend. So installing hand sanitizers, little kiosks, if you will, that would be something that we could definitely consider and figure out how to put in our budget.
So if we put it in there, would you get it?
We could, yeah, we can certainly, yeah, we can price that out. It'd be a bit more than $15,000 for all our sites, but we could certainly, consider that, or whatever, if that's the amount, or that's where you would prefer it be designated to. So we're completely open as far as that's concerned.
Awesome. Thank you very much. And quickly, just off the subject, Ms. Adams, what is the director of development? Do you oversee physical development in terms of housing, or development within the community recreation centers?
Physical development. So
Okay.
so the redevelopment of Newtown 20 and Blum, but also the modernization and rehabilitation aspect where sort of maintenance, where maintenance graduates into actual rehab.
So she's in charge of upgrading all of our buildings.
Very nice to have on board. I hope we become best friends.
Yes.
Any questions from other committee members?
I don't have a question. And it's not the subject at hand, but I just want to commend you for looking ahead at whatever the school year brings us. And I heard that you have the free internet and that you're talking to the county schools just to prepare these kids for whatever we need to do in the fall. So I thank you so much for that priority that you're taking.
Thank you.
So I have a question. So in the midst of this COVID pandemic, are you looking for other creative ways to engage the children on your properties so that they won't have the idle time to increase crime and to get in mischief? Because it's been a lot of mischief going on in the midst of this pandemic because it's really nothing to do. So is there any way you can use some of this funding to incorporate creatively some things that the youth can, do?
We would love to do that, actually. And that has been a concern of ours and of a lot of our partners. I know it's been a great concern of Patty Mendez and the programs that she likes to provide to our children and a lot of our partners too. So we would definitely welcome. We adjusted our programming to slowly graduate to more in-person programming because we know, especially the summertime, virtual camp, it's kind of hard. It's really nice outside and naturally kids want to get out. And so we've transitioned from a virtual platform to more outside activities. And now we've opened up our pool 3 days a week, all of it with restrictions and occupancy limitations. We're also partnering with the city. They have a pop-up fishing camp that our staff helps with now every week. So we are completely open to any ideas that you may have for additional activities or types of programs. We have a whole resident services department that's willing to partner as far as that's concerned. So we're very concerned about that issue and open to ideas.
And I have one more question about in lieu of the pandemic, the epidemic hasn't gone anywhere, and a lot of the fatal overdoses are happening on your properties. Is there anything in place for harm reduction or prevention on site that can help assist with that outside of crisis response in the safe stations?
Well, we do have resident service coordinators on site to assist residents and to connect them with the local resources. I just had a conversation yesterday with Shirley Gordon from Street Angels, I believe her.
Street Angel Project.
Yes. And so we talked more in depth about how we could bring more services to our sites. And so I look forward to developing that partnership with her. So that there could be more access to the resources. Because that's another issue that we are, definitely concerned about. So thank you for bringing that up.
Thank you.
Any more questions from the committee? Awesome. Thank you both very, very much. I really appreciate it.
Thank you.
Next up is the Lighthouse Shelter, and I see that Miss Jenny Crawford is on.
Yes, I'm
awesome. Thank you.
No problem. I'm the development director for the Lighthouse. Unlike the other Jennifer development director here tonight, I do the fundraising for the Lighthouse. But I have a brief statement I'm going to read, which addresses all the points that Teresa has circulated in advance. Throughout the COVID-19 crisis, our staff has worked harder than ever. Despite the odds, we have continued to provide life-changing support to those who need it most, providing basic needs services to an estimated 30% more clients than our pre-pandemic levels. Given the community living environment and maximum occupancy levels at our main 10 Hudson Street facility, the Lighthouse has operated with an abundance of caution and is pleased to report that no clients or staff have tested positive for COVID-19. Since the beginning of March, the Lighthouse Executive Director and Deputy Director have been in regular discussions with the Health Department, county officials, our federal partners, our Board of Directors, including representatives from Anne Arundel Medical Center, and the Lighthouse Facilities Committee, comprised of architects and commercial business developers and engineers, about how to restructure the space and include enhancements that are barrier to viral spread. We continue to successfully move shelter residents into safe and stable housing, find housing options for our chronically homeless community clients, and divert many at-risk individuals and families from ever becoming homeless. Our BEST program adapted to a virtual classroom setting, continued to provide skilled trade training, and graduated their class of students on July 1st. Our food programs also dramatically shifted to provide hot meals and pantry items to hundreds of individuals and families each week during the crisis. The Lighthouse respectfully requests funds to provide additional rental support and food insecure services to vulnerable community members, expand staffing to help us serve the 30% increase in clients coming to the Safe Harbor Resource Center for basic needs services during the pandemic, and provide salary support for staff working on the front lines. The Safe Harbor Resource Center is our community program and provides basic needs, outreach, and prevention services to people at risk of becoming homeless and the circumstantially homeless. The Lighthouse expects to serve an additional 180 unduplicated households, or 540 people, through the Safe Harbor due to the economic crisis resulting from the pandemic. These are clients who have lost their jobs or have sick family members and are faced with the inability to provide for their families, many for the first time in their lives. The Lighthouse stands ready to assist our community members in need. We are currently providing food, clothing, laundry, case management, referrals, rental assistance, financial assistance, and emergency hotel stays to our Safe Harbor clients. The Lighthouse COVID-19 Relief Program has received $10,000 from the United Way of Central Maryland, $5,000 from the Community Foundation as an increased need in the Safe Harbor Resource Center due to COVID-19. Additionally, ACDS awarded 2 consecutive pandemic relief eviction prevention program grants through the CARES Act in the amounts of $100,000 and $150,000. However, only 10% of each award, which is $25,000 total, is eligible for administrative and program costs. The remaining $225,000 is pass-through funding restricted to rental assistance. The first $100,000 in rental assistance was expended in 8 weeks, a clear demonstration of the monstrous need. Additional funds for program and salary support have been requested through the County ESG COVID-19 Response Program. Finally, the Lighthouse has historically relied on in-kind contributions to support our Client Choice Pantry. And while our food insecure clients have increased as a result of the pandemic, donations have naturally, due to self-isolation recommendations, dwindled. Financial support is needed to fill the gaps in pantry and meal donations. COVID-related housing assistance is being provided by ACDS, Community Action Agency, and Partnership for Children, Youth, and Families. COVID-19 client case management, basic needs, and day services are also being provided by Sarah's House, Partnership for Children, Youth, and Families, and Arundel House of Hope. Support for literally homeless impacted by COVID-19 is also being supported by the DSS outreach team. However, as many of my other colleagues here have stated, the demand for these services during the pandemic is great, and it is a challenge to meet that need. All efforts have been coordinated response between county and city organizations, managed through participation on the County Homeless Coalition, of which the Lighthouse is a part. Any questions?
Great. So I'll start and then open it up to the committee. My first question is, because anytime I have tried to get money for rental assistance in the city, I mean, I've went to the city manager, I've went to Teresa, I've went to the mayor, everybody points me to you. So what has that experience been like throughout this process? Because that's my, one of my big things. And as we get to the end of the governor's eviction moratorium, I've already had families literally reaching out like, "What? I don't know what the hell I'm going to do." How does that process work? And do you anticipate additional funding from county or federal agencies to kind of assist here, and not only Annapolis, but in the county in general?
We do, and I have to give just major acknowledgement to Karen Williams, who runs that program, the Safe Harbor Resource Center, and is doing all the housing assistance. She's just superwoman, the way she's been able to execute these funds. The different funding that we get, there's some rental assistance, there's prevention assistance. What we've been the beneficiary from ACDS is the eviction prevention program, which is from the CARES Act. There is a broader definition of who can fit that. It's below the 60% AMI. So we do have some more flexibility there, as well as, the longevity of how we can support them and the reason for them falling into this crisis. So that has certainly been beneficial. We are hoping that there will be further funding for that. I imagine that there will be as this economic crisis continues to unfold. However, if we do come up against limitations in public funding as far as housing assistance is concerned, then we'll go after it privately as well. But as far as access to the funds, they are sent to Karen initially. She has a team right now of only 1.5 supporting her. So given, as I said, the increase that we've already gotten, anticipating, about 540 extra people for this next year, which I think is a really conservative estimate just based on the pace and, as we continue to see this downturn happen. So a big part of the request from the city of Annapolis, from CDBG, as well as the ESG at ACDS, is to scale up our staffing so that we can continue to do this and really hit that immediate need and do it with efficiency.
That's awesome. And would you mind, by any chance, if we could, maybe I can get your contact from Teresa. I'd like to get in contact with Karen if possible. You mentioned her name.
Absolutely.
Awesome. That'd be great. Thank you very much. I'll open up to the committee for questions. Nancy?
My question has to do with what happens when the grant is totally expended. What do you expect to do with the staff? Sorry, that's my dog. What do you expect to do with the staffing that you will bring on?
The increase. So right now we're anticipating hiring on a temporary basis. Mm-hmm. That said, prior to the pandemic starting, Safe Harbor Resource Center was really restructured and reopened back in January 2018. We had kind of a community outreach arm, but it had really been focused on alumni. We weren't serving that many people over the course of the year. It's about 150 clients on average. So we did a full restructure. We did a larger emphasis on prevention and diversion, trying to keep people out of shelter to begin with and getting them permanently housed, as well as those hotel options, and then the at-risk population as well. So when we reopened it back in 2018, we expected maybe population size, maybe about 300. We ended up serving over 600 households, and we have for each of those 2 consecutive years. We were on track to do the same for this past fiscal year, and obviously we've exceeded that because of the pandemic. So back in November, we had a retreat with our board of directors who've been looking at this program. Clearly, it's addressing a need. It's something that we need to expand on further. We're seeing folks both from the city of Annapolis and from the county as well. And so we have a task force to look at the long-term plan for what we're going to do, both because we have physical limitations on space and really what the client population is. We looked very closely at the study that the Community Foundation did, the Poverty Amidst Plenty, and then what we have capacity-wise for emergency shelter, and again, trying to keep people out of shelter and get them permanently housed, especially with families. Obviously, it's much more structurally sound and beneficial to get them immediately housed rather than to always be in transition in different housing sets. So what Joanne Matson, the executive director, and I hope is that we would hire these folks on a temporary basis, but that would also give me runway to look for additional public funding as well as private funding to make those permanent positions. Because regardless of what happens, as COVID-19 continues, we need substantially more help. And the fact that Karen and her team have been able to do what they have since 2018 with 2.5 people, it is really, really amazing, and they need more support.
Okay. And one other question: if you don't get the total amount that you've requested, do you know what you would cut out, if anything, or how you would fund the gap?
Great. We won't cut out anything. Our mission is to serve those most in need, and this is where it's happening right now. I have a team of 2.5 for fundraising. And so, it puts additional pressure on us to find the money, but we will find the money. And if we have to pull from our reserves, we will pull from our reserves, and then we'll evaluate fiscal year 22, 23 down the road. But this need has to be met. We're confident that we can continue to execute at the pace we are, and significantly more as long as we can scale up. So we'll find a way.
Okay, thank you.
Yeah.
Tony Pratt, how many families are you able to house?
Families?
Yeah.
In the past year through the diversion program, so not coming into shelter and housing them directly, 53.
How many do you have in-house at the Lighthouse?
In-house at the Lighthouse, we have 5 in emergency shelter. Those families stay there from anywhere from 6 months to 18 months, just depending on their situations. We've been able to keep those folks on shelter because they are separate apartments. I did kind of allude to the individual community living arrangement. We did have some folks in hotels. In addition to that, we also operate the anchor houses. Those are transitional properties. We have a duplex on West Street. And then we also have a multi-generational family house on Smithville.
So are all your residents at capacity?
Our residents are at capacity, correct. Yeah. So that's one of the reasons why, the board and Joanne Matson has been looking to diversion. It's also becoming a best practice in process across the nation. Again, because of that consistent upheaval that they're dealing with, and as a way to prevent multi-generational homelessness in this continuous cycle, if we can house them right away through private funding, through programs like rapid rehousing, eviction assistance, then that is the way to go. And given the nature of our city and our county and affordable housing, that has been determined by the Lighthouse that is the best way to proceed.
Thank you.
You're welcome.
Any more questions from the committee? Awesome. Thank you very much.
Thank you.
And next up is restoration. No, actually, I think it's one more before that. Sorry. I need to go back to the list.
I don't know what happened.
Does anybody have that list up by any chance?
I think it's the last one.
The
I
list.
think restoration is the last one.
Restoration is the last one.
Yes, it is.
I'm
Oh, okay.
here.
I'm sorry. Yeah, I thought there was one before. Last one is up is Restoration Community Development Corporation with
I'm
Pastor
here.
Stroman Mendez.
Can you hear me?
Mm-hmm.
Can you hear me?
Yes, we
Yep,
can.
we can.
Okay, because I got lost somewhere. That's what happens when you're a senior citizen. Okay. Thank you all very much. First of all, let me just share that I appreciate the opportunity to be on this call today. So let me start with the questions. Describe your organization's current COVID assistance activities. Well, it's been an amazing experience. Just to share with you what has actually taken place, I'll start with the fact of our youth program, which is our actually H2O for Life Clubhouse that we actually have been in Robinwood for over 7 years now. What happened, this is ages 11 to 17. We've never stopped because we're considered essential service with my organization because we are a Maryland Food Bank pantry at our location in Brooklyn. And we've been there for 2 years working with the health department. And I've partnered with the health department for over 21 years now. So what we've done, just so you know, we're excited about the fact that we've been able to purchase, and we did this prior to the pandemic, about 15 Chromebooks so that we can continue to help our students with their homework, with those things that they were doing e-learning. Unfortunately, sometimes it was not working. The children did not have all of the services that were up in Robinwood. Well, our children don't just come from Robinwood. We actually have our actual site in Robinwood, but they come from Newtown, they come from Woodside Gardens, they come from Clay Street, they come from Eastport, they come from all over, and we pick them up every day. During COVID, we were unable to pick up all of the children, so we did about 10. And what we did was actually take them down to my other location in Brooklyn, which we have another clubhouse there. And so that we had computers, We have other Chromebooks there that we can assist the children with their services that they needed. For us, for the actual pandemic, we have actually been able to go to and take the food to Eastport, Robinwood, Whitmore, Bay Ridge Gardens, Woodside Gardens, Annapolis Walk, Adams Academy, Admiral Oaks, Annapolis Walk again. We have Pitt Moyer that we've been there several times. And when we have additional food, we provide it and we take it down to Center Street, to the Center of Health, that we have persons who have actually brought the food there for us. We also take food to Stanton Center when we have extra. Of course, what we see that's taking place right now is because there is such a large pandemic with food. So you would understand what was going on with the pandemic, the COVID pandemic. We have given out over 100,000 pounds of food, over 100,000 pounds since, and we just didn't start in March. I think we were started around January or February that we actually set up at the sites. We are partnering with the mayor's office, OEM. We're partnering with the police department, fire, CERT, our Church Light of the World, RCDC, Y of Central Maryland, the Maryland Food Bank, the Anne Arundel County Food Bank, the Partnership for Children, Youth, and Families, Anne Arundel County Public Schools, Jody Rissy, and of course, Ann Heiser Bazzelli with the Health Department, and Tara. One of the issues that we see or opportunities for growth is the fact that our children actually need healthy food. So on my team, we actually have a professional nutritionist. We have someone who's licensed for nutrition, because we believe in providing protein and healthy food for the children, because that's what they're missing out. Not giving them candy and cookies. It's not just having food, but what are they having to stimulate their brain and their mindset and their health? So that's what we provide. The other piece that I see that is taking place as we're talking about CDBG funds, we have already purchased what we have. So some things are fluid right now. So Teresa is aware, our goal is to, we've been asked to do a couple of things. Number one, our original plan, and we're going to continue with that, was to open a food pantry in Robinwood where we are, because there is a need for children and families to have access to food. But also we've been asked to open an actual food pantry, Maryland Food Bank pantry in Pitt Moyer. And all of this has taken place since we wrote the CDBG grant, and we're partnering with the city right now. We're working on our MOU to see that that is done. In addition, what we will do is to deliver food to persons who are in the zip codes who actually need the food and cannot have access. We are serving, so even though I said we did about 100,000 pounds of food, the number of families that we're serving when we go out equate to, at least when you think about 5 people in a family, an average of 5 people. And when we bring the containers of food, right now they're pre-boxed. So what happens, there's 17 pounds of just fruit and vegetables. We go out to other partners to get meat. We get, today, I just had about 500 pounds of vegetables that were delivered to me, that we'll be taking to a site tomorrow, and then we'll be back in Annapolis, of course, next week again. We will be in Annapolis, and we're working through this with the partnership and some other organizations to be in Annapolis with a pop-up pantry every Tuesday. But if everything works out for Pitt Moyer, we will be there every Friday providing food for several hours so that persons are healthy and can get healthy food. What we're asking for is a partnership that we can actually have the refrigeration. There are certain requirements that have to be done as far as refrigeration. There are certain requirements about the type of shelving that we have in our pantries, and to be sure that our food is healthy, rotated out as it should be, so that we can be sure that the families are healthy in the food that they're receiving. One of the pieces that has taken place that we are excited about is that we just did with Maryland Public Television, we were asked through the health department to have Maryland Public Television come out, and they did a special with Annapolis. We were at Woodside Gardens a few weeks ago, and that's currently on YouTube as well. And our organization did a segment with showing what we do in our food pantries and also outside working in the community. And also the next part of it, segment of it was, of course, with Dr. Nilesh, who is our health officer for Anne Arundel County. So as we see the 21403 and 21401 zip codes, some of the numbers were pretty high with, I think 21403 we had like over 583 persons with COVID, and 21401. And I know those numbers have gone up to like 428. And then we saw 21409 with 73. But what we're looking at are those persons who are the most vulnerable, who are scared, who are really don't know what to do. And so we want to be sure that we eliminate the part about them not having food as one of the things that they would not have to worry about. And I don't know if I mentioned, but we also purchased a 130-inch blow up screen so that we can, and we purchased tents. We also, for our children, so that we can do programming outside, as Melissa has said, and we work with just about every one of the persons that have been on the call tonight. And the Feed at Arundel has been absolutely marvelous to bring healthy food to our students and to our families and to every giveaway that we've done, totaling anywhere from 600, 650 to 1,000 meals that they have provided for us. I want to be sure I cover everything. So there is right now, prior to us, right after us writing this piece for the grant, there was a request for us to partner to open a permanent or a static pantry, food bank pantry in Pitt Moyer. And the place has been identified, and that is what we are currently working on at this time. I think that's about it.
Awesome. Are there any questions from the committee? Tony, I see, we'll go Tony, then Alderwoman Tierney.
So, good evening, Pastor Cheryl.
Good evening.
Couple of questions. Is all the food that you receive for these events donated food from the pantry, Feed Anne Arundel, or what have you, or are you also purchasing food?
We would have to purchase, because one of the things that we're doing, Tony, is that it's not just the food. We want to be able to provide, so for things like we give out things like products for soap powder or diapers or whatever. Those are some of the things that we want to buy. Plus, what you have to understand too, and I'm sure you have heard some of the comments about what happens sometimes from the pantries, is that the food is not necessarily healthy. We will not provide anything that is not healthy for the persons that we serve.
I think that's it. Thank you.
You're welcome.
Alderwoman Tierney.
Yeah, that was my question as well. I was curious on where you got the food and how you keep it so healthy, you know. And then also, where are you on Tuesdays? You mentioned
we will be on Tuesdays. We will be in at Pitt Moyer. We have, what we did was, Alderwoman, is that we actually partner. We have a wonderful partnership with the city and with Chief Simmons and also Mandel and the others. What I allowed them to do is to identify as a partner for me where they feel the most needs are. And so we go to those areas so that we're not just stagnant in one area, and we are sure that we're servicing everyone in the community. However, what we found out is that our numbers have grown. So those of you who were with me and Alderman Gay, I don't know if you were with us that day, but at Pitt Moyer, we had over 600 cars to show up, and we were not able to feed everybody. However, the locations are so important because we started out just with walk-ups, and now we're having drive-ups and walk-ups simultaneously. So we try to identify areas, and I give OEM that opportunity to share where it is that you think the most need is. However, there has been some changes because there's so much going on. So we want something that is permanent. So we were asked to either do, it was either Whitmore Park has been absolutely awesome, or Pitt Moyer. So I think they have concluded, we'll be at Pitt Moyer, because I might be a little confused. We'll be at Pitt Moyer for a couple of Tuesdays, but they actually want the giveaway from now on to be at Whitmore Park. However, that is still under discussion.
Thank you.
You're very welcome.
Thank you very much.
Any additional questions from the committee? Okay. So what I know for sure is we're about to take a 5-minute recess. And then after we do that, we come back in closed session. Now, Teresa, would you like the presenters to stick around and come back after the closed session, or are they free to go now?
They're free to go now.
Okay.
I mean,
Thank you.
And you will give them, is there, can we give a quick estimate on turnaround time on how they'll get an email, maybe with disbursement amounts and stuff like that?
Right. Well, the committee will make its decision tonight, and then it has to either go to the finance committee or the city council. So I've got to work that out because this is a little different. Probably not quite as long as it takes to do CDBG, but hopefully within a month.
Ooh, that long.
Wow.
It depends on, it's got to go to the finance committee, and then Joel, can you help me out with this? Legally, where it would have to go?
Joel, are you on still?
Joel, help us expedite, Joel.
Hello all. How's everyone doing?
Good.
Doing
Good. How
good.
are you?
Okay, I was just paying attention to hear my name. What is the question?
The question is,
Okay, go ahead.
once these, the decision is made how much to fund each organization, it then has to go to the finance committee and then the city council for approval.
Does the finance committee receive, well, so how does the money get to the city from,
From HUD. Yeah, it's a
so,
grant from HUD.
and so HUD has already dispersed the money to the city?
No, it's a reimbursable, so.
It's a reimbursable. Okay, then I think it probably would go to the finance committee,
Okay.
because as you know, our budget, the money we're receiving is going to be reduced. So if since it's a reimbursable, we have to spend it first. We have to figure out where the money is coming from
Right, and
to
I
get
think-
reimbursed.
Okay, so they have to go to the finance committee and then the city council on.
And so what we will likely do, and I will probably, Ellie, back me up here if you feel I'm going in the right way in terms of the council, is because we are on recess in August, we won't have an opportunity to look at any of this. So we'll have to get it on finance committee's agenda next week, and then bring it to the city council on the 27th, I think, which is our last meeting in July.
Yeah, and we'll suspend the rules to get it voted on. But just so I'm clear, the finance committee, they are aware of the allocation, right, of the money, but we still have to review with them the disbursement of it. Didn't we get this, the HUD allocation? I thought they were aware of. Maybe I'm wrong.
Well, I'm just going by what, this is new, so I'm going by what we have to do with CDBG normally.
Okay.
So normally it has to go to the finance committee because it has to be 150 some thousand has to be appropriated.
Right.
And then the finance committee gets to rule on all the expenditures.
Sure. Yeah.
So.
Okay. And they're
Unless
meeting.
we can talk to Jody, I'll talk to Jody tomorrow and see if we can speed it up somewhat, some other way.
Yeah, just,
All right. Oh, I'm sorry.
that's worth checking, because I thought in the budget, it was an 11th hour thing that we approved the allocation, and then I guess, you know, the disbursement is a different thing. I'm just trying to expedite, but check with Jody, that would be helpful.
Yeah, I'll check with Jody first thing tomorrow.
Yeah.
Yeah, and I think, yeah, that's something we all agree on. It should probably be expedited just due to the seriousness of the testimony we just heard, and yeah, just trying to make sure that people are taken care of.
Right.
So we'll definitely check on that. Again, thank you all for joining us tonight and presenting, and for all the hard work that you're doing in the streets and making sure that our city is taken care of. I really appreciate it on behalf of this committee. And I'm sure that everyone else feels the same way.
Yeah, except, yeah.
Thank you.
Yes, thank you. And your CDBG regular letters will be going out.
Great. Thank you.
Thank you.
Thank you
all.
very much. Thank you,
Have a
everyone.
wonderful weekend.
Thank you.
Thanks for keeping everybody safe.
Thank you. Bye-bye.
Bye.
Bye-bye. You know, guys, that's what's amazing is I don't know if everyone addressed it, but there didn't seem to be any cases mentioned, any positive cases of COVID, at least for the, you know.
Within the staff, yeah.
Yeah.
Okay, so I need 5.
Yeah.
Okay. All
Okay,
right.
5 minutes.
5
Yeah.
minutes.
Yeah.
So we'll do a
My
5
dog
minute.
needs 5.
So
My dog 5 to protect.
Ryan and then Joelle, for the legal purposes, I just want to make sure that we're right on this. We can either take a motion for recess quickly and then come back, or we can log out of this open session, take 5, and then come back to the closed session.
So I believe that now that if you have concluded the public part of the meeting, you could actually go into closed session and then take the recess in the closed session.
Okay.
Does that make sense? Because
Absolutely.
then it doesn't make sense to come back just to go into closed session.
Perfect.
So how do we do that?
And so
I haven't done that, so.
I believe we now close the public session and then recess and then go to the closed session.
Yeah, but what do I have to do on my computer to do that?
I think we remove us from YouTube. I think that would be the proper.
Okay.
And so we have to take a vote really quickly. Someone can make a motion to move to a closed session.
Okay.
Make a motion. Close
Okay. I second that we move to closed session.
All in favor?
Aye.
Aye.
Opposed?